know, the beautiful hospital, that's an oxymoron like jumbo shrimp or military intelligence, right? We all know that there are no beautiful hospitals. It's a terrible place to go with bad food and bad smells. That's changing, and it hasn't always been like that either. So what you're looking at here is the Asclepion, which is the first hospital. It's in Epidaurus, Greece. And it was a series of buildings, or a complex of buildings, so I call it a hospitalopolis, which is a hospital-less city. And of course, it's on a hilltop, so it's an acropohospitalopolis. So, say that 10 times fast. But that's design, and that's what we're here to talk about. In this complex, the patients, the first patients, because this is also where the first physician practiced, Galen, so this is the first hospital with the first hospitalist. The patients would check in, and they would go through a spiritual cleansing. They would go through a physical cleansing. They would spend the night in a natural surrounding, an open room where the gods would come at night and heal whatever ailed them, and they could talk to the gods, and then they'd be discharged. Fast forward to the 21st century, hospitals have become machines for healing, more than spiritual centers of the community. However, within the last 20 years or so, and especially rapidly in the last 5 or 10 years, there's been a whole body of science created by research and practitioners of healthcare design called evidence-based design, and it's modeled on evidence-based medicine. What are the proven 10 best ways to heal somebody? They do that in medicine, and they do it now in healthcare architecture. So that's what I wanted to talk about. And, hospitals have always been the center of the community. Health now is the center of our community and our worlds. So, evidence-based design, research, and practice. I wanted to sort of go through David Letterman's top 10 list of what you can do in your hospital design to make it not only a machine for healing, but also a humane place to heal. High tech, but high touch. All right. Top 10 list, number 1, views to nature. Humans are biophilic. We are part of nature, and we're attracted to other ecosystems and other parts of our natural world. Evidence-based design has documented that a patient with a view to trees, for instance, versus one in the same kind of room with the same sickness and no view of trees, just a view of another wall, for instance, heals faster. The patient with the view heals faster, requires less medications, and has a better experience when they check out and report, how was your experience in the hospital? In some cases, they're dismissed a day earlier, and they use less medications, as I've said. Again, we're part of nature, natural light. These are all pictures of actual hospitals or designs that are in progress. Natural light, it helps our circadian rhythm. Again, we're human beings are part of nature. We're not robots in a machine for healing. We need to have natural light. It helps our rhythms. It helps find our way through the building naturally without signage. Not only do we want to be inside of the building looking out at nature or having nature come in, we want to be able to interact with it. This is a children's hospital where the kids are outside playing in the grass. They're touching grass, they're smelling flowers, they're hearing water and birds. All this has been proven to help us heal. It's not just the medicine, it's this fourth factor. First factor, mind, body, spirit. Fourth factor, in my architectural opinion, is the architecture and the landscape architecture that helps to heal. All right, here's the typical contemporary patient room, but what's not typical is there's a place for grandpa to hang out. There's a place for her favorite stuffed animal. There's a place for plants. So the takeaway in terms of evidence-based design is provide places for the things that comfort us outside of the medical care, for the things that comfort us, our family and friends and favorite toys, so that we'll heal faster. It's been proven, evidence-based design, that these elements help us to heal. This is sort of the silent client, staff. When we're designing a project, whether it's a house for a couple or a hospital, in this case, in a hospital, the patient is a client, but really, who's supporting the client? The staff. They need places where they can get off stage and where they can regroup. Healing is hard. They're not robots again. They're not robots. These are human beings who are watching life events happen right before them. They need a space and a place where they can recharge. On the next item, I don't even know what number we're on, in the 1 to 10, wayfinding. Make the building easy to walk through without signage, so that you can have different elements, whether it's the lighting, or in this case, another children's hospital. I think children's hospitals are probably the best for these kind of things. This is sort of an aquarium motif, and you can see it in the floor. You can see it in the elevator tower there, where there's a defined entrance, and so on and so forth. Let the building be part of the healing, just like you're letting the building being part of the, let the building be part of the wayfinding, and it'll also help with the healing. Reducing stress in a healthcare situation, in a hospital situation, goes a long way towards helping the patient and the family. All right, it's a picture of food, but what I'm saying here in this picture, my sort of top 10, give the patient, the staff, the family choices. De-institutionalize the institutional experience. If you have choices for food, or if you have choices for art, picking your own art in your hospital room, picking music, even picking which side of the corridor you want your bed, your room to be on. These choices help us to humanize our stay, and I would call it part of the non-medical healing. As long as you are being treated humanely and getting those normal choices you would have at home or at work or at school, even though you're in a hospital, this is going to help your healing. It's going to help your family. It's proven. It's evidence-based design. Okay, here's an image. I like to call this high-tech, high-touch. All right, we all want our medicine to be delivered competently, but we want to know that we're going to a safe, humane place. Another children's hospital. This is playful, yet it's technological enough that we know, okay, good care is going to be delivered here. And this is proven through use of colors, making the building a piece of art in and of itself. So it's the art and the science of healing, just like the art and the science of healthcare. This is the Hemingway room. My cue for this one is a clean, well-lit space. Okay, when you go to a hospital, you want it to be well-lit, clean, like Hemingway talked about. The acoustics are good. This is a hospital in Australia. It just has a soothing feeling. It's all white. It's not hospital green. So different cultures, different hospitals do it differently. But we want to just have that calm, clean, well-lit place for healing. And a place for the family, and a place for some personal artwork and a view to nature. This slide kind of encapsulates a lot of different ideas. Flexibility and options. We all, as humans, want options, especially to de-institutionalize that experience, make us feel human. There's places for adults, there's places for kids, there's places for one person, there's places for 3 people. How can we have those options? Okay, so the takeaway, all buildings are healing, whether you're in your office, at your school, at your house. Use this top 10 list and come up with your own top 10 list so that no matter where you are, the architecture is part of your experience. You're not just there as a robot in a machine. Let the hospital or the house be part of your healing every day and your experience. Thank you.